Hi, my name is Phil Zeltzman. I'm a surgeon in Pennsylvania, and I'm going to share some general discharge instructions with you before your cat's surgery. So our goals are very simply, it's to reach success and happiness, and that requires following some very strict rules, which I will explain in a moment. Now, please understand that these rules are provided for all of the surgeries I do for cats. So we will tweak things depending on what your kitty's specific surgery is. So again, it's general information. In addition, what follows is what pertains to my patients and my clients. So if you're not going to have surgery with me, please be sure to follow the information provided by your surgeon. Before surgery, we will typically ask your vet to provide a sedative to give the night before and the morning of, to make your kitty happier and less stressed out, and also to decrease the amount of anesthesia. Typically, there's no food after 8 p.m. However, it's very important to offer water so that your kitty is not dehydrated, especially before anesthesia. Drop-off will be in the morning. Please be sure to leave all of the medications your cat is on, as well as all supplements. We also will ask you to provide food so that there's no issues with your cat's stomach, and we would like 2 meals. Sorry. During anesthesia, your kitty will be monitored by a nurse whose only job is to keep your cat safe. And we monitor all the important vitals, just like in people. So EKG, oxygen, CO2, blood pressure, temperature, heart rate, respiration rate, and so on and so forth. After surgery, we will recover your kitty and provide plenty of TLC and warmth, and we'll make sure your kitty is as comfortable as possible. We definitely provide a lot of pain medications before, during, and after surgery, and that can be by mouth, it can be IV. We include pain medications directly in your kitty's IV fluids, so that at every drop, your kitty gets a little bit of a microdose, really, of pain medication. If we do joint surgery, we'll inject pain medications directly into the joint. In most cases, we will numb the whole surgery area with a pain medication that stays around for 3 days, up to 3 days. If we do joint surgery, or even in other cases, we'll also inject a pain medication directly into the area. So that's 6 different things we can do to manage your kitty's comfort. Whoops. We also will dispense medications at home. So that's pain medications and anti-inflammatory drugs, depending on the case. So we'll tailor that to your particular kitty. And we might also dispense some arthritis supplements. We will give some IV antibiotics and ask you to follow up with antibiotics by mouth. If for whatever reason we don't inject an antibiotic, that stays on board for 7 days. So typically, the only thing you'll have to worry about at home is the pain medications. We tend to dispense liquid, if that's what you prefer, to make your life easier at home. After surgery, you should get 2 calls, one from one of my nurses, who will call you to reassure you that everything went well and your kitty recovered well from anesthesia. And then I will call you when I'm done with everybody, typically in the evening, to share more information about the actual surgery. Like I said, we might provide some joint supplements. We'll need to know what your cat might be on, and then we'll decide if the quality is high enough. And if not, then we'll make a recommendation for 2 different supplements, and then we'll tell you how you can get more after the fact. Your kitty might experience what is called dysphoria, And it's basically because your cat is completely discombobulated after anesthesia and may do strange things. So it could involve crying, hiding, not interacting normally with you, or ignoring you, or refusing to eat. It's just like people who have anesthesia and who have dental work or surgery. You may have seen these funny videos of people who have no clue what they're saying, and they don't even remember they said it after the fact. So this is called dysphoria. It is stressful for a pet owner, but thankfully it's not related to pain, and your kitty will get out of it fairly quickly, typically by the next day. Now, when your cat stays at the hospital, you hopefully will not experience that. After surgery, healing starts, and you basically need to treat your cat like Crystal. So that involves basically complete R&R for whatever reason, whatever duration we discuss. So the first thing is providing an area that is safe and comfortable. So we typically recommend a very large crate. This is definitely not a bird cage or a kitty carrier. This is a large crate where you could fit a German Shepherd or a Great Dane, because your cat needs a litter box, a bed, food, and water, and an area to walk around. So that is a big crate. Occasionally, clients have a small room with nothing to jump on. If that's the case, I'm okay with that. Most of the time, the safest place is a very large crate. Now, depending on the situation, we might recommend decreasing the amount of food to 75% of normal to prevent weight gain when your kitty is inactive. Sometimes we'll recommend a special food. It could be for arthritis or for weight loss, or to prevent bladder stones, or to manage crystals in some cats. Sometimes we'll recommend physical therapy. If we send out a culture or a biopsy, I will be the one calling you in 7 to 10 days after we send them, so we can go over the results together. Most kitties will go home with a plastic cone. It's very important to keep it on round the clock, 24/7, no exception. There's a few cases where we don't dispense a cone. For example, if we do surgery inside the mouth, your cat can't get there. Or if we do surgery on the neck, the sharp edge of the cone would rub on the incision. So in that case, there's no e-collar. There shouldn't be too much to do to the incision besides making sure your cat doesn't lick. As you know, a cat's tongue is very rough, and it would take seconds for a stubborn kitty to remove staples or stitches, potentially open up the incision, which might require second surgery and another anesthesia and more money, and another cone, because we need to protect the new incision. And if not, it can simply cause a lot of ugliness and pain and infection with which we need to deal after the fact. If you need to clean the incision, only use tap water, nothing but tap water, no antiseptic, no alcohol, no peroxide, no triple antibiotic, just tap water and a soft cloth. Now, suture removal is a generic expression that we use. And when you make an appointment with your family vet, that is the only thing the computer knows. So you'll need to be in charge and understand what we recommended and make sure that is happening. So it could be 14 or 21 days after surgery. And in some cases, it's staple removal, and others, rarely, it's suture removal. And in other cases, there's no stitches to remove at all. So it's called a suture recheck, where basically the stitches are below the skin or within the skin. And what we'll ask your family vet to do is to check the incision, make sure it looks good before you can safely remove the cone. Follow-ups will totally depend on the exact surgery we perform. It could be a simple exam, it could be x-rays, it could be blood work, or it could be to check the range of motion to make sure you're doing a good job at physical therapy after a fracture repair or joint surgery. In most cases, there will be some form of rehab, which is basically a way to slowly transition your kitty from a very strict rest to normal life. And I typically will be the one calling you, and we'll put our heads together and see what your cat is driven by. Is it food? Is it toys? Is it you? Is it command? And then we'll see how we can slowly increase the activity in a safe manner. And we'll typically do that over 4 weeks. So that's how we do things at this practice. I will absolutely call you before surgery to make sure you understood everything, see if you have any questions, and make sure you're comfortable with everything. I will provide these links below this video so you can click on each directly, so you don't have to retype everything, and you can find more information about e-collars and arthritis and physical therapy. And I thank you for your trust and your time, and I will talk to you very soon about your kitty's surgery. So thank you so much. I will talk to you very soon.